the big one for me that I didn't get to last time, if you've been in the industry for a while, you might remember it was, I want to say like 2021. Um, it was they called them cancer kits or
Mm.
CGX. And I'll give a little bit of a backstory about what this, and I think to my understanding, it might still be going on today to some degree. But the idea is that Medicare was going to start paying to cover genetic testing for cancer.
I remember this well.
Yes. And obviously, it made sense from a health insurance perspective because if you can start to get an idea of who's more likely to have certain types of cancers, because it wasn't there was I can't remember how many different cancers they were trying to genetically trace, but there were quite a few. So what would happen is a package would be sent in the mail to a senior. They'd have to swab their cheek, which again, hindsight being 2020 on this, the idea behind trying to get a senior to go through these steps is kind of bonkers. But you're sending a kid in the mail. They have to swab their cheek. They're putting it into a liquid. They're packaging it up. They're putting it back in. I can't remember. There may have been like a little form they had to fill out, and then they had to, put that kit back into the mail. It was all prepaid. Then it goes to the lab. The lab has to then verify the sample, test it to see what type of cancers potentially someone could be genetically linked to, and then those results get passed back to them, and obviously also to I don't know where else it was going, to be honest. I wonder if do you think the carriers were getting some type of metadata on this? They had to, right? Some sort of like not no personal information, but maybe they were getting like actuarial data. Because I'm trying to think, like Medicare has to be getting some of this data, right? If they're going to be covering the cost, and then maybe the carriers are somehow getting a part of a piece of that data too. I don't know. Do you remember anything on that side of it?
Not in particular. I remember there was a lot of scams surrounding it that was going on, and
Yes.
it was one of those things where it was being used as an opportunity to scam a senior and get their information. So they would kind of go through the whole process, the swab of the cheek and the mail and everything. But then also they'd be like over the phone when they were booking everything, they'd be like, we're going to need your Medicare number or your social security number. And they go through all this information. And then all of a sudden their identity was stolen. And we had it happen to a few clients of ours, actually.
Yeah.
Um, and so that's what really I remember the most about it is all the scams surrounding it, because it was like the flavor of the week, as they say, when it comes to
Yes.
scams at the time.
Yes. Did you participate at all in this? Wow.
I did not at all.
God
No.
God bless you. Yeah. I'm
I was
glad.
I was a skeptic. The nature of me is skepticism, right? So I was a
Yeah.
skeptic. Sometimes that's bad for me, but other times, in this case, it was probably good.
I think it probably was good. So, um, the scam that I ran into was on the other side of it, is being promised, again, every time a kit comes back and gets processed through the lab. I'm trying to remember right now off the top of my head what the dollar amount I was being promised per kit was. I want to say it was somewhere in the 500 to $1,000 range. It
Wow.
was a lot of money. I remember thinking like there was, because obviously like you have all these different fall off points in the chain, right? You have people who commit to doing it and then they get it in the mail, they never do it. You have people who get it in the mail and then they don't swab correctly, and when the lab gets the kit, it doesn't test, and so they're not going to pay you on it. You've got people who, it gets lost in the mail or whatever. So, I'm already thinking in my head, it's a numbers game, right? Classic kind of sales angle on this is, I get 100 people to commit. We send out 100 kits. If half of them send it back to the lab and then maybe a third of those are billable, yada, yada. So I'm thinking all I've got to do is get 20, 30, 40 of these billable, and then I'll double down and kind of rinse and repeat the process. So um, started to sink a lot of money up front into this before I ever saw a penny return, because again, I'm just thinking blue ocean, right? Like no one's doing this yet. It's brand new. if I can get in front of this, because that's the other part of this was once a senior did it, they would no longer qualify. So
Mm.
it was also, it kind of felt like, I wasn't there during the gold rush, but I'm assuming this was about what it felt like, right? I just felt like it was a sprint. It felt like the first one to get to that finish line was going to be the one that got the bag. So I started to sink quite a bit of money. I mean, to this day, it's definitely five figures. I can't necessarily say exactly how much because a lot of it was kind of broken up over a period of time and it was spent on different things like our dialer, our payroll. There were some shipping costs. There was some stuff like that involved. So it was well over five figures. Never saw a penny that got back to me. Allegedly, the lab claimed, because I kind of chased this all the way to the top, and the lab claimed that they weren't getting paid by Medicare. Um,
Mm.
and then I think the lab ended up closing down and opening under a different name. And then it becomes this whole thing where it's like, there's this lab, it's on the other side of the US. What does the lab even look like? Is the lab even legit? Is the lab just bullshitting Medicare and trying to bill them, right? This goes back to that whole Medicare fraud
Mm-hmm.
conversation that we talked about earlier on the pod. And so to this day, I don't really know what the truth is about what happened with that. Did these kits ever even get processed? Was the lab even legit? Did the lab just have issues with billing Medicare and Medicare didn't want to pay because the lab was doing something wrong or they weren't registered? Like, I can't even tell you. I honestly don't know what the truth is, but it just got to the point where I had to cut my bait. I had to cut my losses and they were too great. And so, hindsight being 2020 on this, when something like this happens, you guys, my recommendation would be see it all the way through, right? See that ROI, right? Just like if you bought leads, you buy 100 leads, you get the sales, and then you can say, oh, the process works. Now I'm going to buy 1,000 leads. Now I'm going
Mm-hmm.
to buy 10,000 leads, right? That's what I wish I had done with this is I wish I had gotten that first check and then put in the five figures instead of being like, gold rush, let's go. Got to go, sprint, sprint, sprint. Let's go. We're going to be the first. We're going to be the first. But yeah, that's my big story I didn't get to last time, but I'm glad you never participated in that when
What
it
year was
happened.
this? What year was
I
this?
want to
By the
say
way.
2020. I want to say 20. No, I think it was earlier. I think it was like 2019. I think
Yeah,
it was pre-pandemic actually. Now that I'm thinking about it.
I remember doing an Everything Medicare podcast about it, warning people not to participate. I remember this very vividly. um, and from my perspective, not from the outside looking in, any client of ours that I saw that did it, or any agent that I knew that participated in it, I don't have a single case that I ever heard about where it actually got processed, like in any scenario. So it
Yeah.
kind of made me feel like the entire thing was just bull.
Yeah.
It's just a big hoax. And it certainly looks like, hindsight being 2020, that it probably was.
Yeah. Yeah.
I remember Medicare came out, even Medicare came out and said, don't do this. Do you remember that?
Yeah. It turned into a big, and then I think it got to the point where the Department of Justice, I think, even ended up.
Yeah.
Um,
Yeah.
that's that's when I really knew that the whole thing was just a scam from the beginning. I'd like to think because here's the thing is I think there were some providers that were doing it. So some people were going to actually to their primary care physician. The
Right.
primary care was like, "Hey, while you're here, Mrs. Jones, you want me to swab your cheek for cancer genetic testing CGF?" And they're like, "Yeah." I was like, "Okay, let's do it." And that was probably where this was legit, right? That's probably
Hmm.
but anything beyond that was because hang on, I just remembered the other part of this. Hang on. I just remembered the other part of this. It was essentially had to get signed off by a doctor. So
That's
it
right. I remember
that's
that
right.
now.
Yeah, that's right.
Yeah.
So I just forgot about it. So I was explaining the food chain of how this was working. And as I was explaining it earlier, I'm like, something's not right. That sounds too easy. We were trying to get so this is where it was kind of sketchy. You had these teledoctors who were ordering the tests or signing off that Mrs. Jones needs this or wants this cancer genetic testing. And I went down this rabbit hole of teledoctors and these teledoctor networks. And let me tell you, there's some scary stuff out there as far as doctors. We're hearing about doctors that are just like, you know, clicking through. They're just trying to sign off as much as they can on whatever gets in front of them, because every time they click yes to a prescription or to a test being ordered, they're getting paid like $20, some sort of, I don't know, I know kickbacks, that's the naughty word. I don't know what their payment is technically labeled as, but that was the whole while. But that was another big piece of this is you had to get the senior to agree, you had to get the doctor to sign off, the senior then had to process, and then you're trying to ship it to a lab. The whole thing was insane. But
Yeah,
yeah,
that's a good one. That's a
yeah.
good one.